Congenital heart disease is the most common form of major birth defects, affecting over 1% of newborns. Congenital heart disease affects 400,000 newborn babies each and every year. This is from A.J. Morrell and published in the Congenital Heart Disease in the General publication from 2007. We would like to think of our kids of running and playing, riding their bikes, or playing soccer. The next time you see your child or your children, nieces, nephews, and or neighbors out playing with their parents, realize how this disease may affect one of them. My family goes through life with a child that was born with a congenital heart defect. After being thrust into a situation of having a child with CHD, I have grown into the world and learned about it very quickly. Congenital heart disease has three main forms. Where there's a hole between the two heart chambers is a septal defect. Ventricle septal defects account for 40% of all congenital cardiac malformalities. And this is in the words of Daniel J. Penny in the Lancet article. Treatment for either one of these is conservative or surgical. Conservative meaning the child will overgrow it as time goes by. Surgical, they'll go in and repair the hole. Small congenital VSDs are often closed on their own as their hearts grow. In such cases, treatment may not be needed. Some cases, surgery is required. Morgan L. Brown wrote in the Journal of the American College of Cardiology, ventricular septal defects are recognized as being a common congenital cardiac malformality. Coarctation of the aorta, where the main large artery of the body called the aorta is narrower than normal. Coarctation are most common where the aorta, the major artery leading away from the heart, arches towards the abdomen and the legs. When a patient has coarctation, the left ventricle has to work harder. Since the aorta is narrow, the left ventricle must generate a much higher pressure than normal in order to force enough blood through the aorta, delivering blood to the lower body. Coarctation of the aorta has an estimated incidence of 1 in 2,500 births, with a 2-to-1 predominance in males. The first successful repair of the aortic coarctation was described by Dr. Crawford in 1945. And this is according to Morgan L. Brown of the Journal of the American College of Cardiology. Pulmonary valve stenosis, where the pulmonary valve, which controls the flow of blood out of the lower chamber of the heart to the lungs, is narrower than normal. This type of pulmonary stenosis results in the reduction of flow of blood to the lungs. The stenosis accounts for 80% of right ventricular outflow tract obstruction. Most common cause of pulmonary valve stenosis is congenital heart disease, or it may be due to a tumor. Treatment varies depending on seriousness of each defect. With septal defects, most are outgrown as the heart grows. Coarctation of the aorta treatment is conservative, but may require surgical reaction for the narrowing of the aorta hypertension. In terms of treatment for pulmonary valve stenosis, a valve replacement or surgical repair, depending on which one of these stenosis is in the valve or the vessel, may be indicated. If the valve stenosis is congenital origin, a balloon valvoplasty is another option depending on the case. As H. Doak wrote in Congenital Heart Defects of Europe, congenital heart disease, CHD, is the most common cause of major congenital abnormalities, representing a major global health problem. 28% of all major congenital defects consist of a heart defect. The estimate of 8 per 1,000 living births is generally accepted as the best approximation, as written by P. L. Brenner in the Challenges of the Congenital Heart Disease Worldwide. Today, circa 2016, there are now more adults with congenital heart disease than children, one of the greatest achievements in modern medicine. And this comes from Changing Demographics of the Adult with Congenital Heart Disease.